these are dark and difficult times to be certain, but I think there are lots of positive things to describe at least from the perspective of biomedical innovation.
Our knowledge of this virus is less than 6 months old, and the incredible amount of information that we've already obtained is truly amazing. We've had the world focus on this virus like nothing else in the past that I'm aware of. We've also had the good fortune of being in a time when biotechnology and the tools we have there are here to help us untangle the mystery of this virus. And this virus is indeed very different. Everyone knows it's a coronavirus, one of 3 that has emerged recently, but I think it's a crafty virus. What I'd like to show with this slide is not so much all the details, but to just give you an overview of where the dynamic changes in these markers happen. You can see that they come and they go, and depending on what stage of the disease you are in, you see the line that shows the onset of symptoms. You can have virus 2 weeks before that, and some of these markers are just coming up, and others are coming up later, but they all play an important role in diagnosis. What is clear is that a positive serology test does not provide proof of immune protection.
What I'd like to do now is sort of turn to the treatment side of things as opposed to the testing. Why 18 months? And I have to restrain myself from saying 18 months is wildly ambitious, because many people's questions is why 18 months is so long. Testing vaccines is incredibly difficult because the way in which we're going to test these vaccines is we're going to inoculate some patients and have control groups that are not inoculated. And then we're gonna let time run its course and compare the 2 groups in terms of the rates in which they get infected. That takes quite a long time and a large sample size to definitively determine the safety and the efficaciousness of these vaccines. The good news is that there's just tremendous amount of action and focus, and that has led to 197 candidate treatments and 111 candidate vaccines as of 3 days ago. Keep in mind, most of these are in early stages, and the vast majority of them are still working either in the laboratory or in animals and are not going to make it graduate onto human trials. So while we're waiting for those new vaccines and we're waiting for those new treatments to come out and lessen the severity of disease, there are at least 3 important things that we need to be working on. The first I've already alluded to, and that is streamlining the drug approval process. Vaccine production is also going to be really important. Vaccine production capabilities are actually quite limited around the globe, and we're going to need to get to capacity very, very quickly. That is not a process that happens overnight, so we need to make those investments in capacity now. We're going to need to think a little bit more carefully about risk and fairness.
That the economic pain in lots of ways has been less in Asia than in here. So by Google data, for example, the decrease in retail in Asia, in the Asia Pacific region, has been 30% over the last few months, while it's 90% in Western Europe and the United States. So you're really talking about almost a different planet between what's going on in Asia and what's going on in Western Europe and the United States. And so with that in mind, I think what I'd like to offer is that there's something being lost in a conversation that's just between we need to lock down or we need to open up the economy. And that binary way of thinking is actually obscuring the fact that there's a massive role to play for a public health system, and that's what really distinguishes the Asia Pacific region to what's going on here. All of this goes to say that there's a lot that we can be doing to emulate the success of countries in the Asia Pacific region while we're waiting for testing, treatment, and vaccines to come online. There's a lot that we know how to do in terms of investing in international health systems and investing in frontline workers. And we've got a lot of science behind that, a lot of experience, and it's something that we can do now while we're waiting for testing, treatment, and vaccines to come online.